Hey everyone, my name is Daniel Sullivan, and this is my presentation. I will be exploring the United States healthcare delivery system and explaining how its main parts, which are providers, settings, and purchasers, and how they work together to deliver care. Understanding how the system works is essential for identifying issues that affect access, equity, and quality of care. By studying this structure, the healthcare professionals can better understand how policies, workforce decisions, and funding impact patient outcomes. Ultimately, the knowledge helps promote fairness, strengthening community health, and also improves the service delivery. The United States healthcare delivery system is a complex network that connects healthcare providers, financial organizations, and service environments. This includes insurance companies, hospitals, clinics, and government programs that influence how healthcare is funded and how it's accessed. This structure determines who receives care, the type of care, and how the care is also paid for. According to Artica, Orega, and Farm 2020, inequities within the healthcare system often come from deep-rooted economic disparities. Disparities contribute to the unequal health outcomes among different populations, especially those affected by poverty and systemic racism. By understanding the relationships within the system, healthcare professionals can identify barriers to care and act and work towards creating a more effective healthcare environment for everyone. Moving on to providers. Providers include specialists, physicians, nurses, and healthcare professionals who deliver rehabilitative, preventative, and direct care. And they also serve as the backbone of healthcare system, ensuring that patients receive quality services that the patient needs. The providers are responsible for managing chronic conditions, offering preventative education to promote healthier lifestyles, and diagnosing illnesses. Their collaboration within the interdisciplinary team improves patient safety and coordination. As Bailey 2017 notes, effective healthcare delivery depends heavily on the provider's skill, availability, and communication, which all directly impacts the patient's outcomes. The providers diagnose and treat illnesses, coordinate care, educate patients about maintaining health and preventing disease. The providers function as both advocates and caregivers, helping patients navigate through this complex healthcare system. Strong provider-patient relationships can also build trust, improve adherence to care, and enhance overall patient satisfaction. The shortages of providers, especially in the underserved communities, are one of the leading causes of healthcare inequalities in the United States. Bailey 2017 emphasizes that workforce imbalances, structural racism, and economic barriers often determine where healthcare professionals choose to practice. This shortage leaves many communities without access to primary care, forcing patients to either travel long distances to receive the care they need. These inequalities often worsen the chronic conditions and increase preventable hospitalizations. By expanding provider diversity, strengthening workforce training programs, and offering incentives for services in high-need areas can help reduce the disparities and ensure quality of care reaches all populations. Moving on to settings. The healthcare settings are the environments where medical services are provided. For example, nursing homes, hospitals, urgent cares, and clinics. Each setting offers a different level of care by addressing the different patient needs and stages and illnesses. For example, the hospitals would treat acute and emergent conditions, while their healthcare clinics focus on preventative and primary care. Nursing homes will support patients who require ongoing medical supervision or rehab services. Having this range of care could ensure that patients receive the right services at the correct time. The access to quality health care varies across different settings and different geographic regions as well. Smedley 2003 explains that disparities often arise from the uneven distribution of resources in the healthcare delivery system. A lot of the rural areas lack hospitals or specialty type clinics, leading to delays in treatments and diagnoses. On the other hand, urban facilities often face overcrowding and shortages of resources that can reduce the quality of care. To help bridge these gaps, we can increase the investment in the community health centers and increase the amount of telehealth services. Moving on to purchasers. Purchasers include government programs like Medicaid and Medicare, private insurance companies, or the patients who pay for their care through out-of-pocket cost. These groups collectively fund the healthcare system and influence how the care is being distributed. The way purchasers manage the coverage and cost directly determines who can use these services in healthcare. Year by 2018 highlights the inequities in financing or major factors behind unequal health outcomes. When certain populations lacked affordable coverage, their access to distinct types of care is also limited. The purchasers finance the systems through premiums, direct payments, taxes, and by doing this, it shapes how care is being delivered and reimbursed as well. Private insurances offers flexibility, but often comes with higher cost. With public programs, they are designed to help the elderly, people with disabilities, and people of low incomes as well. To address this, the policymakers must work to expand affordable insurance coverage and reduce the barriers and finance to care. These inequities also contribute to greater healthcare costs due to preventable hospitalizations and emergent care use. By expanding these more affordable insurance plans and enhancing the consumer education can help create a more equitable healthcare system. In conclusion, the United States healthcare delivery system depends on the collaboration of purchasers, care settings, and the providers to ensure that patients receive the most effective care. Although progress has been made, affordability, quality, and disparities and access continue to challenge the healthcare delivery system in the United States. Williams and Cooper, 2019, argue that reducing structural and racial inequalities require the ongoing commitment and accountability. As healthcare professionals, we play a critical role in the process by advocating for policies and procedures that promote equal access for all patients. By strengthening the healthcare professionals' cooperation between these key components, the healthcare system can better serve patients and serve a healthier community across the nation. These are my references I used, and thank you.